Let's say you or your child just got prescribed Focalin, or its generic form, dexmethylphenidate. You're holding the bottle, maybe a little unsure, thinking, is this just a different name for Ritalin? Or is it something stronger? The answer is it's related, but not the same. In fact, it's more refined, more potent, and in many cases, more effective. Focalin is the single isomer version of methylphenidate. What that means is it contains only the active isomer, the part of the molecule that actually does the work, the part that improves focus, attention, impulsivity. And yes, it's therefore about twice as strong per milligram compared to Concerta and Ritalin. In this video, I'll walk you through what makes Focalin, and especially Focalin extended release, or Focalin XR, a standout option for ADHD treatment. In fact, one of my favorite go-to options. I'll cover what it does, how it compares to other medications like methylphenidate extended release, Concerta or Ritalin LA, the side effects to watch for, and my own clinical take based on working with thousands of patients who have been on this. I'm Dr. David Danish, a double board certified psychiatrist specializing in ADHD across the lifespan. Focalin is a stimulant that treats ADHD by increasing dopamine and norepinephrine in key areas of the brain, particularly the prefrontal cortex. That's the area of the brain where we manage attention, working memory, and self-regulation, meaning controlling impulses. But here's what makes Focalin unique, especially compared to methylphenidate ER, its ancestor, if you will. It's a single isomer, it's cleaner, a stronger signal because Focalin only contains the active half of the molecule. It delivers a more focused response in your body. You're not getting any of the filler isomers that mostly are inactive. That can mean better symptom control with lower doses, and sometimes that means fewer side effects, all things being equal. One of the other things I really notice for a lot of my patients who don't tolerate amphetamine stimulants as well, that's like Adderall or Vyvanse, Mydayis, due to anxiety, mood swings, or crash symptoms in the afternoon, actually do very well on Focalin. It tends to have a smoother onset and gentler offset compared to amphetamines, especially in those who are overly sensitive to amphetamines. Focalin extended release uses a 50-50 innovative bead design. Half of the dose kicks in right away, and then the other half kicks in about 4 hours later, giving it a more consistent coverage across the whole day and more flexibility compared to something like Concerta's osmotic release system, which can feel rigid or just not as smooth for some patients. On average, Focalin extended release is less likely to cause insomnia, appetite suppression, or emotional irritability compared to other stimulants. Not always, but often enough that it's my go-to for sensitive patients who don't do well on the stimulants such as amphetamine and Vyvanse. I've seen Focalin extended release outperform Concerta, Ritalin LA, Metadate in many of my patients, in the majority of my patients who try both, especially those who had a partial response to methylphenidate extended release, but never quite got fully dialed in. Focalin allows for more precise dosing and cleaner effect profiles. Now, dosing can be confusing, especially since Focalin is more potent than Ritalin. I'll include a free written guide on dosing strategies and food timing in the MindVault at drdaviddanish.com. But here's the quick version. Focalin extended release comes in a range of doses from 5 milligrams all the way up to 40 milligrams. I rarely ever go above 30 milligrams per day. Because it's about twice as strong as methylphenidate, the child who is on, say, 20 milligrams of Ritalin LA might do very well on 10 milligrams of Focalin extended release. Adults often start at 10 milligrams extended release and adjust based on response. For fine-tuning, you can add a small afternoon dose of Focalin immediate release if needed. As always, the key is to start low and adjust very slowly, especially in children, teens, and adults with anxiety or mood sensitivity. Like all medications known to humanity, and especially all stimulants, Focalin is not side effect free. But in my experience, its side effect profile is often more manageable than other stimulants in its class. For a full breakdown and strategies for managing these effects, again, check out the MindVault, and the resources will be linked below. It has a list of every side effect that could happen, as well as when to get an EKG to make sure you don't have any heart problems that may interfere or be contraindicated when using Focalin. Here's a quick overview of some to watch for. Common and usually short-lived side effects include loss of appetite, mild insomnia, even trouble staying asleep. Some complain of dry mouth, even chapped lips. Some will have a mild headache. Some complain of mild anxiety or irritability. And then watch for weight loss over time if the appetite suppression is too intense. That's definitely something I've seen happen. Now, some people are a little bit more sensitive to their heart rate increasing on these medications, whether it's Focalin or any other stimulant. Same for blood pressure, so make sure that is monitored over time. In my younger patients who tend to have more emotional impulsivity, emotional reactivity, watch for rebound symptoms as Focalin wears off. It tends to be a little bit smoother wear off compared to, say, Concerta, which I like, and that means less reactivity. But if you are seeing that high reactivity in the afternoon, make sure you think about whether or not the patient is hangry, if they've not eaten enough at lunchtime, or whether or not you might need to dose a short-acting dose right after school to help them transition through that evening irritability. Obviously, if there's any kind of chest palpitations, chest pain, shortness of breath, aggression, sudden personality changes with any medicine, including stimulants, notify your practitioner right away. Go to the ER if necessary. To me, Focalin XR is one of my favorite precision tools and one I reach for often. It's especially effective when someone is sensitive to amphetamine stimulants or someone has tried higher and higher doses of methylphenidate extended release, but it's only giving partial results. This one usually fits the bill perfectly for those people. If you want fine control over dosing without pushing total milligrams too high, this is also a good fit. It's also one of my favorite tools for kids or adults who need a cleaner response with a fewer amount of emotional ups and downs. Yes, you still need to watch for appetite issues and sleep disruption, but overall, I found the balance between effectiveness and tolerability to be better than most alternatives in the stimulant class. If you or a family member are starting Focalin or wondering if it's the right move to take next, know this: it's one of the most refined ADHD medications we have. And for many patients, it offers a smoother, more focused experience than other medications in its class. If you want to go deeper into dosing tips, food interactions, or managing side effects, visit the Mind Vault at drdaviddanish.com, and I'll be sure to put that link in the description. And if this video helped clarify things a little bit, hit the like button, comment, or share it with someone else who's navigating ADHD treatment. I'll see you in the next video.